Congressman Brian Higgins is on the WBEN Live Line. Talk about health care reform and town hall meetings. Morning, Brian.
Good morning.
We've heard a number of times you say why you don't hold town hall meetings on health care reform, because you're meeting on the issue every day. Why not have a town hall meeting? And when we ask this question, to what degree is the debate over holding town hall meetings distracting from the issue?
Well, I think it's a big distraction. It's a forum for confusion and chaos. Look, the people who are, advocating for town hall meetings, we know where they're at. They're opposed to health care reform. The bottom line here is the private for-profit health insurance industry does not want competition. They don't want a public not-for-profit choice for the American people. Why? Because the profit health insurance industry rations care. They underwrite to exclude people with pre-existing conditions, and they make a lot of money. Think about it. Last year, we paid nurses $39,000 a year, very important to the healthcare delivery system. We paid primary care physicians $152,000 a year, very important to the healthcare delivery system. Last year, you paid the head of Aetna, a for-profit health insurance company, the CEO $24 million a year. The CEO of United Health, $15 million a year. The CEO of WellPoint, $10 million a year. So I think what's happening here is the healthcare dollar is not going to those who deliver quality care, but those who ration care and underwrite to exclude people with pre-existing conditions. The American people deserve much better.
Do you like H.R. 3200? That's kind of been the lightning rod for a lot of this protest. Are there things in there that you would want to toss out and not include also?
Dave, it's a $2.5 trillion annual industry that represents 17% of the American economy. Our health care costs are too high. Our performance, our clinical outcomes are not good enough. We're 34th out of 191 countries. That's unacceptable. So I think what H.R. 3200 does, it gets us on a path away from fee-for-service and toward complete care. I look at, don't talk about a European system. Let's not talk about a Canadian system. Let's talk about an American system. Why is it that the Cleveland Clinic delivers the highest quality of care, not only nationally, but in the world, at the lowest possible cost? Why is that the exception? I want that to be the rule. I want the people of Buffalo and Western New York, I want the people of New York State, I want the people of this nation to have access to the highest quality care at the lowest possible cost.
So do you think 3200 will pass?
3200 is the first bill out of the House. There are two successive bills. It goes to the Senate. There is a lot of debate left before any final bill is voted on.
Still, Brian, why should Americans invest in a plan that overhauls a system when the government has not proven its mettle in regard to Medicare and Medicaid?
Well, I think if you talk to people who are recipients of Medicare, a lot of people like the care that they receive. Under health care reform, they will not only have that as an option to hang on to, but also a not-for-profit option to choose from. And I think choice and competition is good for the American people, and it's good for the American economy. And that's what the private for-profit health insurance industry is so afraid of. I think they're terrified that the public plan, the public option, may work to reduce costs overall and to improve quality moving forward. And, again, there are many examples in this nation, in America, which is very, American in terms of its principles of competition and choice. The Cleveland Clinic, the Mayo Clinic, Grand Junction, Colorado is another place that delivers the highest quality health care at the lowest possible cost. And, the problem economically with health care is that it's breaking businesses. Small, large, and medium-sized businesses are going broke where they can no longer compete because of the high cost of health care. It's punishing individuals. About 1 million people go into bankruptcy every year because of what medical or health economists refer to as the medical debt burden. So we have to begin to address these issues not only from a moral standpoint relative to healthcare delivery, but also from an economic standpoint as well. A lot of our problems economically are associated with a health insurance industry right now that is not delivering on the promise to Americans.
All right, Brian, we're out of time. Thanks for joining us this morning.
Thanks for having me.